Why is Ki-67 important for ILC breast cancer? Imagine trying to understand how quickly a fire is spreading in a forest. Ki-67 is like a gauge that tells us how fast cancer cells are dividing and growing in invasive lobular carcinoma of the breast. It is a protein found in cells that are actively dividing, so measuring its presence helps doctors see how aggressive the tumor might be. In invasive lobular carcinoma, which is a specific type of breast cancer that starts in the milk-producing lobules, knowing how fast the cells are multiplying is crucial for planning treatment and predicting outcomes. A high Ki-67 level means the cancer cells are dividing rapidly, which often indicates a more aggressive tumor. This can translate into a higher chance of the cancer spreading or coming back after treatment. Conversely, lower Ki-67 levels suggest a slower-growing tumor, which might have a better outlook. Because of this, Ki-67 serves as a useful marker to help doctors estimate the prognosis of patients with invasive lobular carcinoma. Another key role of Ki-67 is in guiding treatment choices. For hormone receptor-positive, HER2-negative breast cancers, which include many cases of invasive lobular carcinoma, Ki-67 can help determine how likely the tumor is to respond to certain therapies. If the Ki-67 level is high, patients might benefit more from chemotherapy or targeted treatments like CDK4/6 inhibitors. If the levels are low, hormonal therapies alone might be sufficient, reducing unnecessary side effects. Monitoring how Ki-67 levels change during treatment is also important. When patients receive endocrine therapy before surgery, a decrease in Ki-67 can show that the treatment is working well. This helps doctors decide whether to continue the current approach or consider other options. It also provides insight into how the tumor is responding in real time. Ki-67 also helps in risk stratification, meaning it helps identify which patients need more aggressive treatment and which might avoid overtreatment. This is especially relevant in invasive lobular carcinoma because it can sometimes appear less aggressive but still pose risks that need careful assessment. However, measuring Ki-67 can be tricky because different labs might get slightly different results, which is why efforts are ongoing to standardize testing methods. In summary, Ki-67 is a valuable tool in understanding invasive lobular carcinoma of the breast. It offers insights into how fast the tumor is growing, helps predict prognosis, guides treatment choices, and monitors response to therapy. Always remember, each patient is unique, and treatment decisions should be made in consultation with healthcare professionals who can interpret these markers in the context of individual health and circumstances. For anyone facing this diagnosis, staying informed and working closely with your medical team is the best way to navigate your treatment journey.